Hey, so a little vet education today. For my lecture today at Mercer, my series was on respiratory disease, so lungs and airway, specifically non-infectious respiratory disease, meaning not a viral or bacterial infection or a fungal infection creating respiratory disease, but many times more either environmental or genetic reasons for respiratory conditions. And they always get a kick every year when I do this lecture because I tend to do a lot of sound effects with it. And they mentioned today that it was very helpful for them to see these different examples, perhaps by a human, of what their pet might be doing to give them a sense of what the condition might be. So I will share with you a couple of those respiratory signs that we can see that indicate there may or may not be a problem. So the first and probably most common and the most innocuous of the bunch, so the one without the most severity by all means, is something called a reverse sneeze. We see this typically in smaller breed dogs, although we can see it in any size, but I find the smallers tend to get it more often. And essentially they are snarfing backwards because there is some irritant in their airway that they're kind of snarfing backwards in order to clear from their schnoz. So they do this kind of sound where they're backwards snarfing. Again, they kind of get bug-eyed and wild-eyed, and a lot of them will kind of stand very rigidly and look a little bit scared at the same time. And many owners think that their pet is choking during these episodes, really having a lot of respiratory distress, when in actuality, it's kind of as bad as a hiccup. It's not really traumatic for them. Again, most of the time is because they've sniffed around and perhaps inhaled something that's a little bit of an irritant. We see it a lot more during high pollen seasons. Some dogs will get it when they're just excited. So we'll see that particularly our smaller breed dogs. So you'll come home from work and they'll get all excited and they'll kind of kick into this reverse sneeze episode. But again, not an alarming condition. Another one we talked about today was coughing in cats, which can be a sign of feline asthma. And we talked about the difference between a productive feline cough, like coughing up or yakking up a hairball, versus the cough that we see with feline asthma, which is essentially they're coughing because their airways are really constricted, and a lot of times they've developed quite a bit of mucus in those airways in conjunction with the narrowed airways, which creates this kind of wheezy sound. And for that, the cats oftentimes will get into this, I call it gooseneck posture. They kind of crouch over and extend, I can't do this sideways, but extend their necks out, really elongating their trachea, which is their windpipe, and kind of have this expiratory type of sound where they're trying again to kind of rattle up and clear up any of that mucus that's kind of caught up in there. So that's kind of characteristic of a cough for felines. Another thing we talked about today is that we really shouldn't see dogs pant, right? Dogs pant from a breathing perspective, and also very many times from a cooling off perspective. That's the way that dogs actually perspire, is via panting. But we should never really see cats pant or open mouth breathe. That's typically a concern and can be an emergent concern when you've got a open mouth breathing kitty cat. I digress, kind of bringing us back more to the sounds of the respiratory tree. The third one that we talked about today was the cough that we'll see with dog COPD or chronic bronchitis. COPD, like in humans, is chronic obstructive pulmonary disorder. And in those cases, much like feline asthma, airways are narrowed. They get a lot of mucus kind of glumped up in their airways, and they cough, and dogs will cough, 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 and then have what we call a post-tussive gag. So post, after, tussive, cough, gag. So they and then they kind of like open their mouths at an angle. Many times their heads are tilted down, their tongue comes out, and they look like they're kind of trying to vomit, is what a lot of people will characterize that as. So this kind of kind of gross post-tussive gag. And then sometimes they'll even swallow back, and that's them kind of swallowing back some of that discharge and secretions. But most of the time, those coughs are non-productive, so nothing is coming up, versus a lot of times with kennel cough, which is a more infectious condition that we see in dogs. Those guys will cough so hard, they actually will bring up kind of white, frothy mucus. And that's pretty characteristic of kennel cough. And then, what was the other thing that we talked about? Oh, we talked about laryngeal paralysis, or LARPAR. So LARPAR, the larynx is our voice box. It's the entrance to our airway as well. And there is a condition that we see in dogs where the larynx, which are these two folds of cartilage up at the top of the trachea, because of issues with the innervation, which means the nerve that's supplying the larynx, it's called the recurrent laryngeal nerve, is no longer working appropriately. So the innervation is no longer making its way to say, hey, it's time to open up. And when that happens, there's actually kind of a partial occlusion or closure of the airway at all time, because that laryngeal fold doesn't open in order for air to kind of come through normally. Most of the time, fortunately, it's just one side. But what happens is we get kind of a characteristic change in the timbre of a dog's bark. Many times their voice changes. So your dog's bark might go from kind of a more normal woof woof kind of sound to this kind of honky, hoarse, like an old man sound kind of cough. And that's kind of a telltale sign that we might have something changing in the larynx. These guys also will sometimes cough when they're eating or drinking. And that's something, this is an older dog condition, but certainly if you see those signs, it's worth talking to your veterinarian about. In particular, and especially here in Georgia, because of that, these guys cannot cool off as readily as their counterparts that have normal usable laryngeal cartilage. And what I mean by that is they can overheat very easily. So these guys are certainly in trouble when it comes time for the hot heat of summer. And gosh, they just double down in humid conditions because, again, we pant in order to perspire, we being dogs. And if there is already the air around us is already saturated, like we are in humid conditions, there's a lot of ambient moisture in the air already, that heat exchange is not effective. So these kiddos with LARPAR, from a kind of medical management or lifestyle management, really need to be walked kind of early in the day and late in the evening when we're hitting the coolest temperatures. So I hope that helped a little bit as far as some of the weird noises, respiratory tree noises that your dog or cat may make. Thanks, guys. Bye.